Hello again. I'm Dr. Shoar. So today I'll be talking about degenerative disc disease. That's a condition that I've heard, patient come to me and kind of frantic. I've gone to my medical doctor. He did MRI of my back, and I was told that I have um, degenerative disc disease, and it's a disease, and they said it's not reversible, and how it's going to progress, and it's going to become worse, and my back pretty soon it's going to fuse together. So kind of scary. But so let me educate you a little bit about what degenerative disc disease is. So here's a good example of a segment of your low back, or so-called lumbar. So you got the disc, you have the vertebrae above, below, you have the spinal cord, and then you have the spinal nerves coming out. Okay, so the disc job is to what? To separate the two vertebrae above and below to create this hole right here where the spinal nerve comes out. So now if I take that disc and I shorten that disc, what happens? That hole gets smaller. So when that gets smaller, what happens? Start getting this pressure on the nerve. So what happens when you put pressure on the nerve? Guess what? You're gonna have pain. And also, wherever that nerve goes to, if it goes to leg muscles, for example, it's going to be affecting the muscle function of the wherever muscle it goes to, whatever extremity this goes to, it's going to affect the that group of muscles. If it's your leg, then one leg would be um, uh, smaller, and so you'll have what you start having what is called muscle atrophies. It means you lose muscle girth. So, and also if it goes to that nerve go to an organ, whatever the organ that goes to, that nerve goes to or controls the function of whatever organ, that organ will not be working at its 100% capacity. So I want to make sure that you understand the effect of what happened when you have degenerative disc disease. So let's look at what how it occurs. So here's a normal spine, so you can see it's nice and healthy. So what happens for people who have the type of job that sit for a long time, for example, a data entry, or someone who's like attorneys that are spend hours sitting on at a desk, reading, preparing for a trial, or finance manager at an automobile dealership. People who sit for a long time, and or a construction worker, that lift things and move things, and they only lift things and move in one direction. What happens to the disc is that the disc is being pressured, actually pushing down, and so the disc is it's not having the lateral motion, which allows the disc to become hydrated. So a little bit about how disc get its nutrient. Disc is between the two plates, so it gets some of its nutrient from the vertebrae above and the one below, but it's mainly made out of water. So it gets its water, and there's no vascularity, there's no vessels, there's no artery going to the disc, because it's a ligament. It has to be very strong. It's holding two bones together. So the question is, how does it get its water? It gets it from the surrounding tissue by a process called imbibition. That's a fancy word, which means when the fluid moves from a higher pressure to a lower pressure. Let me give you a good example. It's a sponge. If you take a sponge, squeeze it and put it in any liquid for that matter, whether it's oil or water, and you let it go, it sucks in the juice, the water into the sponge. So I want you to think about a disc. It's like a sponge. So when you move to one side and let go, sucks in some of the juice from the surrounding tissue. Of course, this happens micro level. It's not like all of a sudden a pint of water gushes in. That's not how I want you to think of that. Think of it that way. So, in micro level, there's some water and nutrient going into the disc. So that's what occurs when you have proper motion movement. So when you're sitting for a long period of time, guess what? Do you see that motion occurring? No. So what happens? The disc gets dehydrated. So weeks, months, and years later, you start having the dehydration of the disc, and then the next step is degeneration, because the disc is dehydrated. Now, the disc is very prone to injury. The disc is now, it's very brittle. It easily breaks. So somebody with degenerative disc disease, if they are involved in an auto accident, what happens? They're going to be hurt. Why? Because the disc is not a normal disc. The damage to the disc will be far more visible and far more, affecting their body than somebody with a healthy disc. So that's why when somebody, let's say in their 50s or 60s, that suffers from this condition, whether it's in the low back or in their neck, what happens when they're involved in an auto accident? They really suffer far more bigger injury than somebody who does not have this condition. So that's why it's important for the doctor to, when they see you after an auto accident, what I do, if I suspect damage to the disc, guess what? First thing I order is an MRI of that area, whether it's the low back or the neck. I order the order MRI just to see the extent of the damage and see what's going on. So that's what happens in a degenerative disc disease. So now that we know a little bit about what degenerative disc disease is, next I want to talk to you about how we can stop it from progressing, and then how do we go about hopefully reversing some of those effects. Okay.